But why don't we call the meeting to order?
Okay.
Anthony, are you coming on video?
I am not. My computer is not capable right now.
Very good. Okay. So it's 7:03 on December 15th, 2021. Let's call this meeting of the Board of Health to order. All present: Candace Linehan, Elaine Silva, Laurel Gorville, Cindy Longo, recording, Anthony Chui. Anybody on for public participation? I don't see anyone.
Oh, I see Cindy. Okay, where?
All right, if there's no one on for public participation, we will close public participation. And who is going to talk about the CTC closing? Was that you, Elaine, or was somebody else going to get into that? Anthony, were you going to discuss that?
Elaine, if you wanted to just start us off on that, I can talk more about what it means for our tracers, but just a little overview, I guess.
Okay. As you know, the state had set up a contact tracers for the state. And what it was to help alleviate some of the tracing to be done by local health departments. So what would happen is that your cases are posted in Maven, which is the reporting system. And twice a day they would go in, and any cases that weren't claimed by health department were sent over to this group, this CTC. Or you could, as a health department, if you didn't have help or you had an overabundance, you could go on to the case, sign in, and assign it to them. The system worked very well for a while. And then anytime there's been a surge, they've had their backup. Sometimes they don't reach people. Sometimes they were better at reaching people. A lot of people don't answer their phones when there's an odd number. It went on, but it was only funded through actually December 31st. But what happened was the state, when all the cases went down toward the springtime, they started to let go a lot of their traces. So when our surge came back up in July, they pulled as many as they could back and they started using them. A lot of cities and towns, as you know, only have one nurse, that some don't even have a nurse, and some only have a part-time nurse. So everyone started using the CTC as much as they could. But we knew inevitably that come November 30th of this year, that they would be gone completely. So they have gone in the terms of they have no longer take any cases. So we don't have a choice, as any health department has also, to turn over any cases to them. What happened is the liaisons are still in effect. And these were people who would call the local health departments and confer with you if there was any specific problems that you had. They're on until the 31st of this month, but it's very, very limited. So what has happened is the Maven system that we use in the reporting system can only hold X amount, which is 5,000 cases a day.
Oh.
So yes, that's how it was done. When Maven was started many, many years ago, the main thing for Maven was to help us in getting to people with infectious disease, such as your Campylobacter and things like that, faster, because at that time everything was paper. So your report was sent in to the Department of Public Health and then sent back out to your local health department. So sometimes you didn't get any paperwork back for 2 or 3 weeks. And when you go to call somebody, can you remember what you ate 2 or 3 weeks ago or where you were? Was very difficult. So this is what it was to make it more efficient. And eventually it brought in the TB cases, which also were hard for us to follow in public health because of a lot of your latent TBs not showing up for appointments. And this gave us access to that and to reach out to the communities much quicker with that. But it's never been built to hold more than that. So the problem being now with everyone, this system being shut down, is that there's so many health departments that are getting maybe 100 or 200 cases a day. And they don't have a nurse, so they only have a nurse maybe 10 hours a week. So they're trying to get them out of what they call the workflow 2 and 3 times a day so that we won't crash the system. The main thing is that we in Melrose and Wakefield have been very fortunate because we have had our own traces and we use the CARE Act's money and some other funding to keep them in place. So we're pretty well off considering. It was a good system. Sometimes, like I say, they didn't get to anyone. And a lot of it is when you're doing tracing is a lot of personal contact. Laura will tell you, she helped us last year with it. And the thing is, some people don't want to answer a phone, especially at this time of year, like last year. I mean, do you want me to call you up on December 19th and tell you that you're in isolation for 10 days and can't go anywhere? It's been, they were good to us. They really were good. They did help us a lot, but we've always had our own traces. So we have just been so fortunate to have the backup from the administrators and the health department here in Melrose and Wakefield, and the amount of traces that we have. It can be very tedious. When we first started, I don't know if you remember, Laura, you probably had like 10 or 20 questions. Now you have 3 or 4 pages, and they've expanded it. And then linking people. If you call a house, there's a mother and a father and 6 children, you've got to link that. We've had the overabundance of schools and trying to trace into the schools. So now with the CTC closing, the thing is that the local health departments will now determine how they will and what they will do for priority in doing their cases. They say now, we used to follow up sometimes maybe 3 or 4 phone calls before you got somebody. They tell us now you can leave a message, but that's something local health departments, we have to work with our legal departments. We're trying to work out and see how we feel comfortable because most of us have been tracing for over a year. And now the main responsibility has come upon the case. If you're a person who's had COVID, it's really your responsibility. The state wants you to stand up and say, okay, I was diagnosed on Monday. I called my employer. I called my close contacts. I had been at work. I notified them. I had been at church. I notified them. My son's on a soccer team, or we play basketball or go swimming or a gym. I've notified all those people. So it's kind of taken contact tracing a little bit different. They're trying to cut down on the amount of phone calls we make. And now when we do get a hold of them, we can do our cases and we can see if the person wants us to call them back after the end of their quarantine or their isolation. Majority of people don't. They really are very well educated. I think that in the last 6 or 7 months, you've seen a lot more education out there. I think that that's something we have to work on as a health department. I'd like to have more stuff, more things posted on our websites and say, you know, if you do test positive, this is what you would do. Wait for someone to call you. When that call comes in, please try to answer them and return the call as soon as possible. And the other thing is with home tests now. The home testing has become very popular. It's a wonderful thing, I have to say. I've had a lot of families who have home tested, found out they're positive, not gone anywhere, but they have to have the instructions to go further, which doesn't seem to be prevalent or to be available. We have to educate them that once they are positive, they have to go and get a PCR to be positive. Your positive results have to be witnessed and to be put into this system so that if at any time there's a question in regards to whether or not you isolated, we can go back into the system and it can be found that you were positive, you did isolate, and you were no longer contagious, or you have completed what should have been completed. I think that's, anybody else got any questions? It's,
I was on the call and I thought that, is she an Epi who did the presentation?
Last week's or this week's?
A couple of weeks, when CIC first was kind of just bringing us through, and I hopped on. And one of the things I had not realized, when you say system crashing, are you talking about the human resource system crashing?
No, that's the Maven reporting system. Yeah. So, and what happens is, you have to remember is that you may have a town maybe that has a high positivity rate, and they may have maybe 200 cases sitting there. Maybe we'll have only 30, and this city has this and this and this and this.
Right.
So that's how you get up to it. So that's what they're trying.
I didn't catch that piece.
Yeah.
What I did catch was, you know, also just the efficacy of the kind of contact tracing that we were done. And this, I think, appropriate move to personal responsibility. So, you know, when I did end of isolation cases, most of those people, and this was in the beginning, you know, had already taken themselves out. They're like, yeah, no, I know, I'm back at work. In fact, in the beginning, there were a lot of test until you're negative before you come back protocols. And then we realized that for PCR, those were going to stay positive for 90 days. But, you know, so it's a big difference. We've really evolved. So I actually thought it made sense in the regards that we wouldn't try to do the 6 degrees of separation kind of futile exercise and grabbing contacts if you know, people actually kind of knew what to do. There's been, you know, the information has been saturated. So Elaine, my understanding then is here as a board, we need to sort of drive what our parameters are. I mean, have we, I don't know, Anthony, if you've already mapped out kind of a priority protocol, but it seems to me that we still want, you know, we still want to hear from positive cases, but God, you would hope, I don't know. It would be so nice if there was some link saying, do you have any questions? Or if you have any questions, or if you're actually symptomatic, you know, these are the people you can call, because we're just, you know.
It's like a repeat. And the sad part about it is now that our vaccination rate is so high and we have so many people now, and the definition of breakthrough cases is changing. And what is happening is people think that because they have a booster, you know, on Monday, that by Friday they can do anything they want, but you can't, you're still not fully vaccinated until that whole 2 weeks. And if they're exposed, there is a chance that they could get the case. So it's very difficult. And I think what most we have to talk about, and we haven't met yet with the tracers, but I know we are going to, Anthony. We tried to, but it's been a busy week for all of us. Is to set our parameters as to what we've seen, you know, your long-term care, your nursing homes. And then I think they came down to, I'm trying to remember, I got to see if I can find that slide. They had one exactly what their suggestions were for us to do. So if you're in a community that has maybe 4 or 5 long-term care or rehab facilities, then of course, I think you're going to make sure that you're on the top of them, that they do take top priority. And the next one is, I'm trying to see, and why can't I find it? Because I have too many things on my phone, too many snapshots.
Right.
So it's just getting used to doing a little bit of a different interview, but seeing the cases still there and seeing people who are vaccinated and seeing the frustration, the absolute frustration from these people.
I know.
I think Elaine touched on it. Obviously, right now with all the changes with the CTC closing, especially, and then also, you know, with all the changes coming to contact tracing and the new variants, and really understanding the dynamics out there, and the boosters, and now the 5 to 11, there's a whole lot of changes going on. And so what we're trying to do is we're trying to come together. And we've been talking among some of the contact tracers. We need to sit down at some point for all the contact tracers to really talk, but we're trying to come up with a guidance that will address some of the confusion that is still out there. One of the first and foremost ones is testing. Testing, you know, with the availability of the rapid tests, obviously, like Laurel said, it's a good thing that we have this out there now. But the problem is with this at-home test, it doesn't get reported. That's the first thing we need to get out to the community. And the idea is after this meeting, we're going to come up with some sort of communication that really highlights the importance of reporting tests. And so PCR is still a test that we're directing individuals to. So you get a positive rapid test. You do want to get a positive you want to go get a PCR to confirm. Otherwise, it won't be in the system. The first group that comes to mind that was really impacted by this is the schools. The schools under DESE are still when they receive a Binax or when they do an at-home test, and they test positive, going to get a PCR is the only way to come back to school. A rapid test at home is not going to qualify. And so that hasn't changed, even though there have been vaccines, there have been boosters. This policy itself has not changed. And so we need to make sure that even as this becomes more and more available, we still make sure that students and parents know that they still have to follow the contact tracing guidelines and the isolation and quarantine, depending on if they're unvaccinated or vaccinated, if they're close contacts or not. If they are positive, you have to go out and get a PCR to confirm. So I think some of this messaging has to come out from both health departments. I think Wakefield and Melrose. The Wakefield Health Department will be putting together kind of a longer guidance that includes close contacts as well as testing.
I mean, I would say that I would trust your contact tracing team and leadership, Elaine, to create the guidelines. I think that you're more qualified than I am in regards to you've been keeping up with all the Maven things. I do remember that in the beginning, we would talk about, day one being the day you were symptomatic or your positive PCR. So it's interesting to me that we won't accept a Binax as, or, an antigen test as a day one, especially if someone were symptomatic or had been exposed within the week. But, it's so trippy, which is what, makes it exhausting. And so, and there's, we need to be reasonable with people. We need to be caring. We need them to understand that we are also exhausted with the nuances,
yeah.
Or, that our people are, and say, and you kind of, like, we know, but, this is the guideline. And, when we were first taught to contact trace, and I haven't gone to any updated trainings, it was all right, get out your calendar. What day did you feel funny? What day did you get tested? Because that was when PCR tests were hard to get. And I'm also worried that, PCR tests are again getting difficult to get. The Saugus group has been swamped. I just looked on, for Yucks, I looked at Project Beacon. They had no appointments between now and New Year's in any of their northern sites. A lot of the, so it's, I don't know that we can overrule that, the MPH guidelines and say first day is symptom or any test, and then you put them, but still insist that they get a PCR as a matter of course, so that we can, do that appropriately and mark them as considered. But the timeline,
that's another thing, is that a lot of the educational piece, and I think Anthony will probably agree, is that with the home tests, they are wonderful. They work really, really well.
Yeah.
I did try a couple of them myself, and I've had a couple of cases that they tested positive and then they went right away. But the thing is that they only have a certain timeline to get there, and to know that they have to go for that PCR. Yeah. And like say, a lot of people have had a difficulty, especially on holiday weekends. They close, and your local places, such your AFC and things, they go as fast as they can. And they have other things too. There's flu now. There's tons of viruses out there, they say. So, and to get one, and I understand, let's face it, if you've got a fever of 102.
Yeah, you're not going to get in your car and wait 2 hours.
Who wants to say, I'm not. I don't know where I would be, but, you got to have that, because that's the only way it'll help us. Because if you test again positive in that 90 days, if you're going on a trip or something, or you're traveling, once they know that, we can help you. We can write a letter saying you're not contagious.
So is a state also, so it can't be an at-home, so because there's an at-home Lucira PCR that comes with that with one of those Q codes to take a picture of. And some people have not incorporated how to get that into the system.
No, from what we understand, no. And I'll be honest with you, most people that have had a positive, like Binex, it seems Binex has been the most available and the one that has been most used because it's used at the schools. And that seems, and that really seems to be, once these people get positive, they want to be doubly positive. So they do go for that PCR right away. Okay. Most people are very good. I've had a couple that said, oh, well, I didn't go yesterday. I know I was told to because they were tested at a job or in a school. Right. And they go, oh, yeah, I'm going to go there. And, you know, it's, well, if you don't go and something comes up, I can't attribute it that you were positive and that you're out. So that's, yeah.
So it's the time, it's time sensitive and getting out of isolation.
Yeah, it is. And to prove that you've served your isolation and that you're okay. Yeah. Well, but if you're over that 90 days or you're not considered fully vaccinated, then you are that case, unfortunately. So.
Okay, so we need to assess what we have on our website as we are now. And I think I think we have a good reporting. You know, when I look at what the town has for the website, and I so appreciate all of their help, but it sounds like we need another page, and it could be there. And maybe I can't maneuver my computer and look at the website and not mess this meeting up. But I wonder if we just really need to almost have a just a test case of a few people, even our youth council, though they'd probably be more savvy than anyone, to go in and say, okay, go into the website and tell us if you're getting the information or whether or not, for how to get tested or what to do if you're exposed or what to do if you're called. Because I think when we've been in it for so long, you become blind to those spots, those holes, because you just sort of fill them in. It's like editing your own paper. You're like, what do you mean? I missed that mistake. So it seems to me that we really need to have people proofread these things who are not public health.
I did it myself. Yes, I did it the other day when they announced all the testing kits going out, and if you wanted to, you could go on the website and you could see everything. And so I thought I would be Joe Public, and I went on, and when I did, I could see a list of where they were going, but I didn't see any kind of directions or any kind of instructions on what to do when I got that and it was positive. So there isn't, and I think that's one main thing. I think, Anthony, we talked about it this week, that we're very, very want to focus on definitely is trying to make it on the website and right where they could go and be able to know exactly what the instructions would be to do to help them. You want to try to give people the best, and this is a hard time of year with the holidays because the testing sites are not going to be as open as much, and you're going to see them very, very busy. And we don't really want people to just depend upon that home test. We still need that PCR. That's the golden ticket. It is the golden ticket.
Yeah, we did talk about it. And I think it's just, as part of our website, and to be totally honest, our website is not, is not the most user-friendly. We do have a good amount of statistics and data. It helps us talk about COVID in a bigger picture. But if we're talking about useful, applicable data or information for the everyday person to really understand what to do in what situations, we don't. So it's something that we need to work on. And this is actually a good time to do that, because once we have it up and running, it'll really answer a lot of the questions that folks have while they're traveling, while they're meeting more people during this time. I think this is a good time to do it. So we can reevaluate that website and really make some progress.
Yeah. Right now at it, and under the tab information and best practices, it's almost there, but it doesn't tell you what to do with that positive home test result. Yeah. It doesn't say, oh, congratulations, you got a positive test result. Now you need to call your provider or go get a PCR at a testing site, or call your local DPH. It doesn't tell you what to do next. It just talks about what kinds of tests are available and out there. And I mean, that information is simple, but it lacks that next step.
Mm-hmm.
Yeah, and just like we have for DESI, we've kind of created a flow chart. You know, something a positive here happens here, then what do? You do quarantine for this long if you're close contact. If you're positive, you're in isolation. We have to do that, I think, somewhat similarly for the community, right? If they receive a positive antigen test, what do they do with that afterwards? And after you get a PCR, you know, they get the results. What does that mean? If they have questions, can they, you know, who to call, right? And that's the Wakefield Board of Health. That's, you know, their Board of Health for their own towns. Everybody's on our website from somewhere else. I think it just makes sense for us to create kind of a more simple flow chart for them to follow. And then that would answer a lot of the questions I think that we get on a daily basis.
Mm.
Okay, so in between giving boosters, we'll make a new flow sheet.
It won't be that bad.
No, I mean, Candace, you know, it looks like, you know, you're looking at it right there, that it doesn't need that much more. We just need to get it in there and talk to Jennifer about it.
I'm sure, honestly, I think a link just needs to be built. I'm sure this information is on the CDC somewhere. Someone just needs to like write a sentence and like, you had a positive test. Here's what to do next. And I'm sure there's a simple flow sheet out there because Wakefield residents can't be the only people wondering what to do next.
Yeah, but I don't think the CDC, I think this is Massachusetts specific in regards to counting. You know, what Maven will consider. So we may need to.
Our days are pretty good. I mean, we end up, your isolation ends always up at midnight on that 10th day. And as I tell people, I don't know what happens if you come out of isolation before midnight, whether or not you turn into a pumpkin or something. Nobody's called me yet. But I believe New Hampshire, Anthony, doesn't it go to like a certain amount, so many hours?
I believe it's they go down to the hour of exposure, and then it goes to, you know, when the hour you can come out of quarantine. It's pretty granular here, but I would say, you know, I'm about to be a Massachusetts resident, so I'm going to follow Massachusetts from now on.
Thank you.
Come over to the good side. Come over to the light.
Yeah, we're simpler.
But I think we can cover a good amount as to what we need to do. I think there's a multi-pronged approach. I think it seems like a quick fix, at least on the website, from what Candace is saying. Just we need to put that little bit of information on there that will really help people understand what to do in that case. And then I think just for moving forward, we have to kind of understand what the availability of the antigen test is, what kind of questions, and we can build out our own frequently asked questions section that a DPH has for a lot of questions in DESI too. If we just put it on our website in kind of an easy to read format, I'm sure that's going to be helpful for folks too.
And we could also utilize the every other Friday call. So there's one this Friday. So that announcement could be reiterated in regards to if you do a home, you know, good for you all doing a home test. I'm going to share with you a picture I took because, you know, I have friends who are now, you know, we all went out and got our binexes to have the day that we have a dinner party together with the windows open, you know, and I think if we can, you know, sort of put that out at the next meeting on the next Friday thing, saying, okay, you know, this is your how-to kit. Because I do sort of feel like our script is getting a little stale. We keep talking about, you know, all we're talking about is numbers, and that doesn't really help people, except, you know, to make them worried or less worried. I'm not sure the numbers.
Like get Jen McDonald on, like do a social media push, like,
yeah,
how to holiday, like, all right, you got plans with your family, like, let's get our rapid test, let's get our PCRs. Like I said to Anthony, I wish they would rapid test the children when they walk out the door of school. Right before you get on the bus. All right, here you go, here you go, here you go.
I know. I have to say the kids have done incredibly well.
Yep.
They're amazing. The parents are getting tired.
All right, any more on the CTC, Elaine?
No, not really. Just it's created quite a bit of problems with a lot of local health departments. I had a meeting with our local public health nurses the other day, and some of them are just totally overwhelmed And there was a drop down that they put in for us to say that if a health department didn't have help, that you could put that in, and then they'd understand why you weren't doing 200 cases every day. And I guess a couple of health departments got called by DPH wondering why they didn't have any help. But I think that, we prepared, but as I had said to our local public health nurses, when we started talking about it, I sent them an email, we knew about this way back in the summer. So by the time Anthony came, right, Anthony, we had everything all figured out. How many?
Well, I gotta give you the credit, Elaine, for carving out those spots before I even came. So you made it easy for me. But I think the foresight there was just to have those contact tracers in place, which really put us in a good position right now.
Yeah, it did, and it's quite a few health departments are very jealous of us right now because we are handling what we have. It's not easy. Some days are more than others, but the contact traces that we have between the two communities are phenomenal. I'm going to tell you, they're great. They're dedicated. They do their work. And no matter how busy they are, they find the time to do these cases and to trace them as much. How long it will go on, I don't know. A lot of people are asking that. Maybe once more, Anthony, our vaccine rate's up there and our booster rate is up there. Maybe we'll see a decrease, but who knows? You don't know what variant's going to come down the road next week.
Yeah. It will be interesting to see what our trends look like coming out of the holiday break and with the new variants. It sounds like, preliminarily speaking, Omicron is definitely a little bit more infectious. It seems to be less mild, but that doesn't really help because if more people are getting infected, and we're still not taking the precautions we need to, our hospital ICU capacity might be impacted at some point with more people getting infected. So we still have to be careful. We're definitely not out of the woods yet. But there's simple things that we can do. Vaccination, wearing a mask, those things still work. So.
Did we approve the minutes?
I think Laurel might be muted.
I was.
Sorry.
Oh, okay. I think she was going to say something, but we didn't hear her.
Did you have something, Laurel?
Well, no, I'm just hoping that we can, I don't see much of a Facebook presence in regards to announcing our vaccine clinics. And I'm wondering if we could boost that, use the school to boost. Someone already asked me if their kid returning for the winter vacation, they couldn't get any appointments. And it's like, yes, you have. How are our numbers looking for signups for?
So we're looking pretty good. Pfizer right now, we're very close to 1,100 signups for Pfizer. We're basically almost full up. So anybody who's still interested, got to get them fast. But Moderna, we still have a good amount left. I think we have right now 300 to 400 left. Cindy, you might want to correct me if I'm wrong, but I'm pretty sure the numbers are close. But yeah, we're filling up pretty quick.
Wow.
So we've been releasing a lot of information. The surrounding communities have been really picking it up too, as of today. So it's been really great that they've been putting this message out there. And this is not restricted just to Melrose Wakefield. Obviously, this is for everybody. Okay. So I feel like we're gonna fill up very soon. I would say Friday is a target date for probably gonna be filled up, but we're just encouraging everybody to just try and register as soon as possible. So.
Do you guys?
The town email went out
It did. Yep. It did. I just feel like sometimes things loop on social media a little bit. Depending on who picks it up, and I don't have an Instagram account. Wow.
I think it'll fill. I don't know if we need to.
No, I guess not. Are we
push much further?
Are you?
Yeah, we're gonna fill up.
Are you needing us to get over to Memorial Hall either on Sunday or Friday to prep?
No, so Friday we've already got most of the preparations ready. With say Friday, we're gonna make sure IT's all set up. We can't really set anything up ahead of time because we have events going on until Sunday night. So a lot of it's going to be Monday morning, but everything's prepped. It's just a matter of Monday morning moving the stuff physically from City Hall across the way to Memorial Hall. Everything else will be ready to go. So I know, Laurel, you're already shaking your head. Don't worry, we've got the best guys on it.
What I realized last week was all the time that I spent with my favorite people. I was too exhausted to go to the nursing home or afraid that I had like picked something up. So I'm not just being entirely selfish about my mornings, but all right, oh my Lord. Can someone do my Christmas shopping for me?
Yeah, give me a list. I'm going out. I'm going to finish. I'll get it for you. Don't worry.
I just need inspiration. Call me, Elaine.
Yeah.
All right. Well, good job, us. Well done. Wow.
Okay, I guess this was a good segue. I guess I'll just give a quick summary of our clinic. So it's on Monday. It's 7 a.m. to 5 p.m. We have nearly 2,000 doses of Pfizer and Moderna combined. We've got a lot of volunteers. We're still looking for vaccinators. We're coming down to the wire a little bit here, so we're asking everybody to kind of tap into their network, see if everybody's interested in giving vaccines. The shifts generally are from 6:45 to 12 and then 12 to 5:30, but people have been calling to fill in a couple hours here and there, and we're more than happy to be flexible and plug people in wherever. So if you know anybody, then give a few hours. Feel free to reach out to them and have them send either an email to me, to Cindy, to Denise, or to Coral. All of us will be checking our emails, and we'll kind of compile them as we go.
Okay.
We're also looking for other volunteers as well. Anybody, even if you're not a vaccinator, we're more than happy to have you. It would be helpful to have more folks doing administration, grading, running, and ushering. So I think it's going to be a good clinic. It's going to be a large scale clinic, and so we have everybody kind of playing a role in making this a safe and effective clinic.
Hmm.
Could we pivot and just approve the minutes, kind of get that off the to-do list?
So I printed the minutes, and by golly, if I didn't like wrap them in a present, but
I thought they looked fine.
they were fine. There was one thing. There's always one thing. I don't mean always. I'm just saying it's up to me to find one thing. The way I was reading the paragraph, it looks like the Peaker, like the difference between Wakefield and Peabody is a little funky in our wording. I don't know if we want to, I don't have the exact wording, but we just have to make sure that, we understand the Peaker plant is in Peabody, mm-hmm. and that power from the Peaker plant will serve one of many communities, Wakefield being one of them. It looks a little, I just felt like when I was reading it, that flipped, but otherwise the minutes were fine.
I think that's good clarification.
Okay.
Do you see it, Cindy?
No, I don't have them in front of me, but I wrote it. I'll take note.
Lane, anything on the minutes?
An audible no.
No. No. Silva, I don't have anything.
All right. Should we take a motion to accept them as amended?
I'll make a motion to accept the meeting minutes as amended.
I'll second that.
All in favor?
Gorville,
aye. Silva. Yep. Go ahead. I'm sorry, Laurel. Go ahead.
Sorry. Gorville, aye.
Silver, aye.
Linehan, aye.
Okay.
Excellent. So moved.
And then Anthony just sent us the letter.
The letter. Anthony, is there anything else for your health director's report?
Not at the moment. No, we've covered. It's really just clinic right now, almost through and through. And then I think the CTC was a good coverage by Elaine, so I think we've covered everything we need to.
All right, so maybe let's just talk about this letter. Julie Smith Galvin sent me a message today wondering what our next steps were and where we were at. How do you feel about it, Anthony, so far?
I think it's good. I think the two things that we're looking for is the environmental impact report and the health assessment. I think those two things are absolutely essential for us to have. I know this is kind of being grandfathered in right now at the 2015A project because it was reviewed in 2015 and the law was signed this year. But I think if we're in keeping with all of the, all the initiatives to keep our environment green and, you know, protecting the environmental justice communities, I think these two reports are important for us to take into consideration. So that's what I kind of tried to include in the letter. In the wording.
It looks good.
Yeah.
I like your pandemic edition.
Yeah.
Is this very different from the letters that had been already sent?
It has some of the same elements as some of the other letters that were sent in, but I think I just wanted to elaborate on some of the adverse effects, and it's not just COVID. These things existed before COVID, but I think COVID only served to show that these are, you know, things that will be affected later on as well. So I think those are just some of the justifications, and I don't think it's necessarily overly complicated to understand why we're looking for these things. So I try to keep it simple there.
Okay, so in the past, it's a great letter. In the past, we've actually added our names and come into the office and sign them.
Oh, I mean,
that was before COVID, but
do that. That's fine. Like, we can all do that if you guys are able.
Yeah, I've looked at previous letters and I wasn't sure exactly the format, but I am more than happy to change that and have all of you come in and sign it. I think that would be better. I just wasn't sure what the availability or everybody would be to come into the office, but let's do that.
Yeah, I think it gives it a little bit more punch.
Yeah, that's a good idea.
Maybe.
I like the part where it says air quality doesn't respect the boundaries of towns. That's elegant.
Yeah.
I try to add a little bit of a Wakefield flair to it, as we call it.
Yeah.
Right?
He's a Yaley through and through. All right, well done.
Thank you, Anthony. Thank you for that. Sure. And so maybe we could aim to try to get there this week and have it sent out beginning of next week.
Yeah, that sounds good to me.
Elaine and Laurel, yeah.
Yeah, I can.
Yeah. Cindy, are you in the office on Friday?
I am.
Okay.
I would probably come like Friday afternoon also.
Oh, the problem is you close at noon.
No.
Yeah.
We do close at noon, yep.
Oh, no, then I cannot come.
Can I electronically sign this, or is that something you have to?
No, we've tried that in the past.
Well, wouldn't you just you'd send out the copy to everybody? Everybody would just sign their copy and then scan it back.
I have all your electronic signatures.
If you do, that's fine. If you can make it look good, I'd be fine with that.
Hey, if you have our electronic signatures, can you just stack them all on there?
Yeah, let me try that.
All
Try
right.
that, and if not, you could
if it doesn't look good, we'll
invite
come.
us back into the office to make it pretty.
Yeah. When do you guys close on Thursday?
On tomorrow?
Yeah.
Yep.
Tomorrow.
What time?
We close at 4.
Oh, okay.
Cool.
All right. So if you guys close at noon on Friday, I wouldn't be able to get there in person possibly until Monday.
Right.
When none of you will be there because you'll all be at the vaccination clinic.
Right.
Well, stop by the clinic. We'll bring the letter.
We'll bring the letter to the clinic. That might be the best. That will be our backup. Just have it on you.
Yep.
I'll drive it to your house at night. Like, there's ways of getting around this.
Okay.
All right.
Anything else?
I think that the clinic this past Saturday was great. And I just want to put a shout out to the kids who found new coping skills. We had several kids who, my heart, this is why I love pediatrics. So we had several kids who had a super rough time first time around. Coral was, everybody was great with them. Another shout out to Kelly Tobin and Sammy. Oh my Lord, she's got skills. And at every one of these things, I steal a script from another provider who I think said it better than I could have. Maureen Garapé was awesome with some younger adolescents the other day. But we had several kids who took hours of delay and anxiety and tantrum on the first one, who came back ready to go and be brave and made us coloring pages thanking us. And it was, it was just a good testament to our approach that making kids wait and prolonging the anxiety is worse than just doing the jab. I think some people think we're a little rough in that regard, but I think we've learned in pediatrics that really is what works best for the kids. We still had some kids who were having a tough time. Anthony, did we talk about bringing those kids, the firsters, back for the second, because we still had pediatric stuff that would be alive and well the first week of January?
Yeah, so we talked about, I think it was only about 90 kids that would need that second dose. So we can definitely give them the option. I think some people are going to opt to go and do it somewhere else, but we definitely have the doses to give them. So what we're going to do is we're going to and we'll work with Cindy and Denise, and we'll pull those numbers. Well, actually, Cindy's going to be doing it. So I'll be working with Cindy to pull those emails for those that got their first dose at our clinic. And then we'll send them out. We'll give them the option to come maybe around 3 weeks after. We'll figure out sometime in the first week of January for them to be conveniently here. And we'll probably end up hosting it somewhere, maybe at our Wakefield Health Department or maybe at Town Hall. We'll find somewhere. And then we'll just give them the chance to come down and get their second dose. So it's so that we don't lose any to follow up. Anybody.
I would be available to do that. Not to mention, we did a couple of parking lot shots the other day. One because the family was in quarantine, so the kids were negative but had been exposed. So rather than, so we went ahead and kept their appointments, but outside with a mother who happened to be a nurse, so she could also assist in observation. And then another family that they were just having a tough time, and so we observed them outside. It worked out.
Yeah, I think it was a great job, and thank you to everybody that was there. Candace and Laurel really helped, squeeze a couple of the kids, make sure they were going to be okay when they got their shots. So you guys did a good job. And Elaine, as always, mixing and drawing. You're the wizard. So
you are the wizard. Oh, the wizard! I'm getting you a hat.
I know. I'm so excited. Wait till you see this. I feel so very bad. There's a girl coming in at 5 a.m. on Monday to be with me, to be one of my diluters.
You guys are gonna be best friends after. Don't worry.
It doesn't matter.
There's gonna be steam coming out of that table. You guys are gonna have to crank.
Yeah. I'm hoping to have
I'll get up early.
7 a.m. at least between 200 and 300 of each vaccine already drawn and ready to go. That's my goal. I have some things, already.
I think we're gonna be pretty good in the morning, because as part of the operations, we're gonna make sure that folks that have their appointment at that time are gonna be getting in. The folks that have appointments later but are coming early, we're just gonna tell them, trying to stay in your vehicle, go and come back at your appointed time. So we try and keep that morning crunch that we usually get in the beginning of clinic a little bit lower. But for the clinic, itself, on Saturday, we ended up doing 556 vaccinations, I think. So that's actually just about 100 over our first clinic with a pediatric. So just a great effort all around, and we're getting our numbers much higher. I think Wakefield's close to 50% 5 to 11-year-olds vaccinated, and we're in good shape.
And 80% of that was done in the first 3 hours.
Yeah,
so I think that lends some feedback to planning, saying, kids are morning people. So we'll figure it out. Someday we'll get it right.
And you know what? If we have a number, I know I figured out, I think I said 89. I gave you a figure of 89 first time is on Saturday. I did get another email that there's another community that has like 70 left over from their clinic over the weekend, and they're willing to give to anybody. And they also expire the end of January.
Oh, that's interesting. Okay, well, we can see how many we need. I think we have just enough for what we need, but I'm afraid I'm a little bit hesitant to take on any extra additional doses that we might not be able to use.
Yeah.
But
if as long as we have at least maybe 4 or 5 extra, because I know that some of the parents that were there for the first timers on Saturday, we did say to them, go home right away and find another clinic and register for it and get them. So you will get it within the 2 weeks, because some were a little apprehensive about not having another appointment.
Right. Yeah.
We'll see.
Well, I'll run the report and get the exact number. I don't think it was close to 90.
Okay.
Yep.
Thank you.
meeting.
I don't have anything else except that we're all wonderful. Have a
January
great
19th.
January 19th.
Ooh, sounds good.
Jeez, wow. And next Wednesday is a wake up. No, next Tuesday is a wake up meeting.
I will be there for that one.
Yay! We have coffee and munchkins. So, January 19th, BOH. Awesome. Well, happy vaccinating, everybody. May we all be well and with people we love over the holidays.
And Laura, do you want to come at 5 or 5:30 on Monday? Which
I'm not making a promise, but if my pajamas are pressed, I'll be there.
Okay. If not, I'll let you come.
I'll put on my makeup before bed. Oh no, just put it out.
Have your mask.
I'll be sporting my best Grinch costume.
I make up. That's it.
I'll make sure you have a Christmas mask. Don't worry.
I'm gonna get a job to protect myself from you all vaccinating people. Lord. Sorry, I'm working.
I don't know if it's any better, to be honest with you.
I know.
Well, it's just
short.
It is
and the
great.
people are fabulous.
We are very, very fortunate that I was telling somebody on Friday at a meeting that she was totally amazed that everybody is like all volunteers, and they keep on volunteering.
They are unbelievable.
Even last week when we were out there and we said that we were going to have this next clinic, and they're like, well, call me, please call me. I'll come. I'll do anything you want, anything. I'm like, okay.
It's an incredible.
Very fortunate.
Incredible. Yep. Okay.
See, Anthony, you came into a great system, Anthony.
I have never said otherwise. I am very sure of that.
That's right.
I'll make a movement to
adjourn the meeting.
Yeah.
I'll second that motion.
All in favor?
Gorville, aye.
And Silver, aye.
Linehan, aye.
Thanks, everybody.